Today we're going to answer two questions that I've seen a lot of you ask. First one being, when should I start preparing to apply for my first nursing job? Second is, how do I become a more competitive candidate in the meantime while I'm waiting to apply? In terms of when to start applying, I advise you to figure out what one or two jobs you really want. Like, let's say you live in the Bay Area and you know your dream job is to work at UCSF or Stanford. Look at what time their next application closes and then try to have everything ready by that date. That way you can use like the cover letter and the resume and everything that you've already prepared for maybe 5 to 10 other jobs that you don't want as much. But the first one that you apply to would be the one that you really want. That way you're not stuck later in a situation where you've gotten a job offer from a job that maybe isn't the best commute or the unit type that you want, and you're wrestling with, do I wait for my dream job application date to roll up, or do I just take this job that I don't really want? If you target it towards the date for the job that is your dream job, then it makes it a little less complicated. So one thing that you can do is, once you've figured out what hospital and what unit you want to work at, you can look on LinkedIn and find nurses that have that exact job, and then you can take a look at what volunteer opportunities did they do, what certifications did they have on their resume. I know for adults it's really common to do the NIH stroke scale certificate. There's one that you can do for ethics, there's one you can do for de-escalating behavioral issues. There are a ton of different certificates that you can do, but if you can look at what certificates nurses that have the job that you're going for have done, you can copy what they've done, and then you can also call up the volunteer places that they volunteered at and see if they're still looking for volunteers, and in that way you're sort of reverse engineering the career that you want. In the description below, I'm going to put a link to a blog post I made for you guys that has all the new nurse residency programs that I could find in a pull-down menu by state. I found all of these by Google searching new nurse residency program and then the city and the state. So I will link that below. Hopefully it'll save you guys a little bit of time and help you find the other 5 to 10 places that you'll want to apply to. I've heard a lot of people say, Mary, I don't know where to volunteer. What would actually be relevant? So if you don't get any leads looking up what other people who have your dream job have done in terms of volunteer activities, when you look on LinkedIn, you can Google something like free health screenings and then type in your area and call up those places that are doing free health screenings and see if they want any help, because that would get you practice with vitals and assessment and talking professionally with patients. You have to get a little bit creative and do a bit of a lengthy Google search usually to find really good volunteer activities related to using your nursing skills, but it definitely is worth doing. Another thing you can do right now to become a more competitive candidate is start writing down your 10 stories that you'll want to use in your interview answers. So it can be a story from clinicals or preceptorship. You know, you'll want one where you were able to redirect a patient who was being difficult, one where maybe you noticed something in a clinically deteriorating patient that you escalated and you got them the help that they needed. You'll want about 10 different stories of things that you handled well that you can pull from and mix and match to different interview questions that you'll get to give you a really strong foundation for things you feel super comfortable talking about to a hiring manager. In terms of work experience, I think the best jobs to take are being a nursing assistant, being a patient care tech, being a medical assistant, or even a phlebotomist or an EKG tech. I think those are hard to beat because it's direct patient care and you are getting practice working with nurses and working with doctors. I think those are really hard to beat, especially if it's at the one hospital that you really want a job at, because it then makes you an internal candidate when you go to apply, which gives you priority over other candidates. The last tip I have for you is something that you're probably already doing, which is watching videos about nursing interview questions and answers. You can watch videos. You can also do a Google search, and they have pages where they just write down a ton of questions, and you can take those and compare those with your 10 stories that you have and try to see how you might be able to start mixing and matching your stories with the different questions.